Dialyzer, on the we use dialyzer, we have to check for a few things too that I didn't tell you over there. The level, okay. So I brought two dialyzers over here so you can see it. You can see this line right here of the bubble. Okay, that is too low. That line actually needs to be above here or higher. It's 2/3 full. You need to check both sides too, because it can actually be one side full, one side not. So that's one thing you need to check. So this dialyzer here, you can see the bubble is higher on there, so I'm using this one here for my reuse. Okay. I'm going to go ahead and put it in the dialyzer holder, so it's safe. It's not going to drop. It's in a good location. I'm going to check the date to make sure it's been at least 11 hours. Okay. There's been well, it's the right patient. Okay, so verify the number with the schedule that you're setting up, and you know that the patient's going to be here. Somebody else is going to verify that before you hook the patient up, but you want to make sure you do it too. Okay, and then go ahead and get your test strip out so that you can test for positive presence of sterilant. So again, take the cap off, stick it in the cap, and you get a little squeeze. This little pad on here will turn black. Okay, go ahead and put the cap back on. Okay, so that's my dialyzer checks. Okay, you want it when you're doing your physical check on here for levels. You're also just physically looking at it. Does it look clean? Does it look like the labels are intact? Does it look like there's any cracks or anything wrong with it? So you're physically looking at it too. Don't just assume that it's, everything's perfect about it. You're making sure there's no big fibrin clots up in there too. Okay, so that's that. Now, stringing the machine, this whole series of tests that have to happen. Now granted, it's been a long time since I've set up a machine, and doing it and talking, a little different. But normally it's a pretty quick process. So I usually start with 2 bags of saline. I go ahead and I hang both the bags up there. We're just going to go ahead and do one. Okay, hang both of them up there. Take out my line and try not to use this bag that makes too much noise for the video. So if you take your lines out of the bag each time, you kind of just gingerly separate them without untaping anything, so you can kind of get them separate. Start with the red line. That's DaVita's policy. This again is a DaVita way to set up machine, not a Fresenius way or anything else. Starting with the drip chamber loaded into the chamber, into the holder. You can let go of the top line because it's not going to go anywhere as long as it's taped. Then I'm going to go ahead and open up my blood pump. I'm going to load this in. Ease it around, the pump stops, go ahead and push it again. Lock it underneath there. Now I can go ahead and untape this and bring this line up to here. Put it out of my way. Blood pressure. Here on the outside is best. Don't throw this on the floor. I'm just doing it so it's out of my way. Okay. Now I'm going to go ahead and give this a little squeeze. It makes it easier to load into the drip chamber holder. Then the light blue line, I usually put facing down right there. Then I take this one, untape it, put it up into the saline bucket. And during this whole process, I'd have gloves on. Okay. Now I'm going to clamp 5 clamps. 1, 2, 3, 4, and 5. I'm going to connect my saline line, which I already told you guys that it would be connected. I'm just going to connect this real quick. Put this out of the way. Okay, now, this is DaVita's policy. They want you to take this line now, and they want you to run it up to the saline bucket and set it right there. Now I'm ready to spike my saline bag. So the line is coiled up down here. Go ahead and undo. We want to go ahead and pop off the blue tab, then take off the spike cover, flip it up inside here, get a little twist. As soon as I did that, saline started to flow down the line. So it's going, and it's going to come out of my saline, into my saline bucket. Okay, I'm waiting for that air to get out of there. And then I go ahead and clamp it. Now I can take this line and actually set it back over here since the fluid is out of it. I'm going to set it right there. Okay, so it's secure. Now I don't have to worry about it falling out of the saline bucket because now it is clamped. Okay, now I need to fill up this chamber, the arterial chamber. I do that by displacing the air. So there's a clamp right here and a cap. I unclamped it, cracked the cap open. You can see the fluid level filling up. It's about there. Close the cap, reclamp it. Okay, so now there's fluid in this section of the line, and right there. I need to turn my pump up to 600. This is called purging the air out of the pump segment. Okay? Press my prime button, start the pump. Now you see the fluid coming from here. It's going to go around. It's coming up in here. Coming up right there. Okay, so it's pushing the air out. And I see the air is out of there. I'm going to go ahead and press the prime button again. That stops the pump. Okay. Now I'm going to connect this to my dialyzer. I'm going to connect this to my dialyzer aseptically. And I'm going to take this, the one that was on this dialyzer holder, flip the dialyzer over, take off the other blood port cap, aseptically connect it to the dialyzer. I'm going to lower my pump to 150. Okay. And now I'm going to go ahead and hit the prime button again and allow this to run. It's a set amount the machine has been programmed to prime. Okay. It's going to prime in the clinic probably 500 milliliters. In here I have it set in the program like 200. So it'll shut off pretty quick. We're waiting for this prime light to go off by itself before we do the next step. Okay? So it's waiting. You can see the pump is turning and fluid is coming out of this. During this time you can actually connect this over here and then do one of them and one. So it's kind of, you can see it like that, you know where it's at. That's where it's going to go. You can't connect anything else yet, according to policy. So, just waiting for this to happen. You can go ahead and lightly tap these, lightly. A little shake. That helps to get that air bubble out of there. Okay, we don't want any air in the dialyzer. Okay, so the prime light went off and the pump stopped. Okay. Now they have you clamp first in the venous line, so I clamped it, and now I'm going to come over here and I'm going to connect the two together. Remove one of the white caps. Open up one. These are adapter connectors. Okay, so now they're connected together, and then once I connect the two lines together, I unclamp both those lines, and I hang them up here. So they're safe out of the way. Okay, now I need to fill this drip chamber up, just like I filled this one up. I go ahead and unclamp that, crack this open, and that displaces the air, and you start to see it filling up. Okay, here's down full. I go ahead and clamp it. Now, I need to clear out, because I need to test this machine. So I'm going to clear out all the alarms. So I'm going to reset that alarm. Okay, so that cleared out that alarm. Go to the test and options screen. I'm going to hit both tests, confirm. I have 8 minutes that I can't do anything on this machine because it is testing. So while that's happening, I would go to another machine and do whatever, work on another patient. So I'm not just standing here for 8 minutes. you have to use time management. So it's going to go through a series of tests. You're going to see the pump run and stop. We want to make sure that all of these X's are on the OK side all the way down. Okay. Any questions?